practitioner is the key. Consulting with your practitioner is the key. And that's why I like this concept of the tele-doctor, where you need to consult. Apart from the physical consultation, also seeing through this tele-doctor, you can also get to reach out to your health practitioner. Consult. Don't just take it on your own. You go to the pharmacy and give me BP medications. No, there are several. Each doctor would tailor your condition to the ideal drug to be given. How do we monitor ourselves? So it's not about starting BP medication. It's not about lifestyle modification. You need to monitor yourself regularly. We usually tell patients, get your BP apparatus. There's the digital BP apparatus everywhere. You can get one. You check. And when you check, we usually say, position your BP apparatus at a level that is that of your heart. So your hand should be on your table, the apparatus is there. Not that you put your hand on the ground. The reading should be abnormal. But like I said, your medication is the very first, seeing your practitioner is the very first thing. Starting your medication is the second thing. And when you do all this regularly, then you can prevent and control this blood pressure. I'll briefly want to talk about myths. There are several myths associated with this blood pressure.
You mean MEAT, right? Aaron,
yes,
myth.
MYTH.
Oh, myths. Okay, myth. Okay, yeah, MYTH. Okay.
Some patients will tell you, I would know if my blood pressure is high.
No, Dr. Bernard. Yes, because I can give it when I go to the hospital and they have to take my vitals. I already know when it's going to be high. If I was talking or shouting at my kid, if maybe my kid went with me to the hospital. So yes, I know. I know when my blood pressure is high, when my heart is beating really, really fast, when Nigeria is playing.
I will get to your own. I'll get to it. Let me take it. I'm going to attend my needs when it comes to this blood pressure. People say I would know, I will feel it. It's a lie,
Okay.
Hypertension is a silent killer. Yes. Some people say they will have headache, they will have dizziness, they will have nose bleeding. There are times you will not notice any symptoms. Yes. And that is the more reason you should check regularly. You should check regularly. Many of us have offices, and attached to our offices are side clinics. It's not a place. When you're above 40 or you have a family history, just go check your blood pressure once a week, twice a week. Regularly, you must check. So checking is the utmost. Don't say, I can feel it. Or you're already taking the BP medication and you say, oh, yes, I can feel my BP is high. No, check. You must check. You must check. Some persons say, oh, high blood pressure is for old people, for we who are 20s and 30s. So let me surprise you. We've lost patients who are young to high blood pressure. And theirs was even terrible because they already came down with end organ damages. I've seen patients, young patients of 20-something, coming down with chronic kidney disease. Eventually, we lost the patient. That's how we lost the patient. So don't say it's for every age. It's for every age. Some people say, oh, if my BP is normal at the clinic, I don't have hypertension. There's this misconception. People say, oh, when you go somewhere, like I'm an anesthesiologist, I'm a critical care physician.
Okay.
I take care of patients prior to surgeries. We take patients through surgeries while the surgeons are working. We are the ones maintaining the patients. And I also treat critically ill patients. Means the intensive care unit is my ward. I've seen the worst of patients, the best of patients, all sorts. So patients will tell you when you talk to them prior to anything, they'll say, I'm not hypertensive. I'm not hypertensive. Our religious body will say, oh, God forbid, you're not hypertensive. But you now ask critically, has your blood pressure been noticed to be elevated? That's when you will not remember that, yes, so sometimes it's only one time. So the fact that your blood pressure has been elevated in more than some instances, certainly you're hypertensive. It's not only caused by stress alone. People say, since I'm working in that office, I'm no longer shouting. I'm not feeling, I just go to work quietly. It's not just stress alone. It's not stress alone. There's this complex interplay from your genetics, family history, to your diet, to your kidney function, to obesity, to lifestyle. All these are implicated in hypertension. So not just stress. If you manage stress and you don't manage the other ones, oh, let's say you want to cool off regularly after work, you're always on the bottles, always on the sticks. After work, you eat all sorts, you're getting obese. You say you are no, now you are relaxed. Now I'm relaxed. If you should not be elevated, no. Rather, these are the ones that will even trigger your blood pressure.
Sorry to interrupt you, doctor. We're going to go on a quick break. We need to take some ads. When we come back, you continue. This is still Women Radio 91.7. This is Radio Doctor. Don't go anywhere.
We are Nigeria's only radio station for women and their families.
Are you number 87? Okay, please wait. How many hours have you wasted sitting in hospital queues just to see a doctor for 10 minutes? There's a smarter way. Introducing TeleDoc, your secure digital platform to consult verified doctors anytime, anywhere. With TeleDoc, you choose how you want care. Need something quick? Go for a quick consult. Just 10 minutes. Need more time? Book a full consult. 30 minutes of personalized care tailored just for you. No traffic, no crowded waiting rooms, no unnecessary delays. Simply book at your preferred time. Join a secure video call inside the app and speak directly with licensed doctors you can trust. Have medical records? Upload them easily before your consultation. From general health concerns to specialist advice, TeleDoc connects you to real doctors, real answers, real care. Download the TeleDoc app today on Google Play Store and Apple Store.
WFM sa inda ɗaya da ɗigo bakwai muryar mata.
Welcome back. This is still Radio Doctor 91, Radio Doctor on Women Radio 91.7 FM. And we have been speaking with Dr. Akaniga Bernard on hypertension, the silent killer. And he's been going down a list of things that you do that you claim is not going to kill you, from stress, stress to what you put in your mouth, either drinks or cigarettes. Yeah. Doctor, please, you can continue.
So salt, one of the things we say, lifestyle modification, we say reduce your salt intake. So when you hear salt intake, it doesn't just mean that when you don't add extra salt. No, there are some persons, if you give them a food, they will say, give me salt. They put salt inside. That is not only the source of hypertension. Your seasonings you put in your meals should also reduce them. You know, some of these canned food, some of them are very salty. You should reduce how you take them. There are times if you want to get some of this seafood, they will package them with salt, to season them with salt to preserve them.
Yeah.
When you consume stuff like that without properly washing, you also get salt into. And you know, salt is one of the content of salt is one of the possible causes in the mechanism of high blood pressure. So there are other ways you can take in salt, not just taking the raw salt into our meals. So just say not just the salt. No, look at the other things around. People will say, yes, hypertension runs in my family, so there's nothing I can do about it. There's something you can do. You can prevent it. What do you prevent? Lifestyle modification. Your diet. Reduce your fatty food intake. Do regular exercises. 15 minutes, 30 minutes walking around your environment. You wake up by 5:30. Within 15 minutes, you are done walking around. Go about your chores and go to work. Salt reduction is also there. Weight reduction is also there. Weight management is also there. Weight management in terms of either if you're into this late night eating, if you're into eating of heavy food or fatty food at night, reduce your weight. And light exercises. These are things you can do. Yes, hypertension runs in your family. You can prevent your own by doing these few lifestyle modifications. People say thin persons are not prone to high blood pressure. That is a lie. There are some obese patients who don't even have it because they're even controlling or prevent it. But there are some slim patients who are hypertensive, and even this could even be due genetic. Yes, it could even be due to stress. Thin persons going through stress. They could even have some hormonal issues. They could be smoking and drinking, and they could also have experienced high blood pressure. So people say my blood pressure goes up and down. It's not real. There's a natural rhythm of blood pressure. In the mornings, when you sleep, it goes down. During your exertion, like you are saying now, when you shout, when you're shooting to school, yes, it comes up. When we define hypertension, we say it's a sustained elevation of your blood pressure, even at rest. Now you're at work, you are relaxed. If there's now an elevated blood pressure at that stage, that's where you now say, yes, you're hypertension. However, a person who is experiencing these fluctuations in the blood pressure, hmm, fluctuating in blood pressure, where it should be low, it's going high, and when you realize it comes down, check very well. There's a risk. There's a risk of hypertension in such a patient.
Hmm.
That is why we usually tell patients, sleep well. If you sleep very well, the 6 to 8 hours of sleep at night, your blood pressure will so relax and calm. That could also control it. That could prevent elevated or persistently elevated blood pressure. People say when they drink plenty of water, it cures blood pressure, hypertension. Is not true. It's when you have blood pressure, you go to the hospital, the doctor gives you medication. Yes, blood excess water is good. It hydrates the body, but it doesn't cure hypertension.
Hmm.
Please. Some people now tell you that, don't start BP medication. No, once I start BP medication, I'll be on it forever. It's a lie. Please, if you know you're experiencing symptoms or you've been checking your blood pressure and it's elevated, you see your physician. When you see your physicians, they prescribe medications for you. Do not hesitate to take your medications. It doesn't mean you're going to be on the medications forever. A doctor can start, we in the sub-Saharan African region, most times, to manage our blood pressures, we need to introduce 2, 3 medications. So when you start, doctor can now, you now come back for a checkup, doctor reduces it. Then you on your own, you are doing your lifestyle modification. So it's not just like you're on medications alone. Lifestyle modification. You do your exercises, you reduce your salt intake, adapt the diet I mentioned. While you're on these medications, the blood pressure will gradually be well controlled. So you don't stop. A patient will not stop the BP medication on his or her own. It's a physician that will direct you on how best to go about using the medication. So there's nothing like saying, once you start it, you cannot stop it. No. You can control your blood pressure while you're on these medications, but you must be on the medications and you're seeing your physicians regularly. People say, I feel fine. I cannot stop my medication. There are even patients who are hypertensive. They took the medications yesterday. They're not taking it today. They've got to check their blood pressure today. It's normal. They say, I'm fine. I don't need to take it again. But let me surprise you.
Mhm.
The BP drug you took yesterday is maintaining the blood pressure today.
Mm.
If you don't take the BP medication today, it will not maintain it tomorrow.
Tomorrow.
And it goes like that. It goes like that. That kind of a patient, before you know it, is already having head organ damages, kidney issues, stroke, and every other problems. So people say when they take BP medications, it can damage their kidneys. Please. There are even BP medications that protect the kidneys. Is when you don't take BP medications, the hypertension itself can damage the kidney. So medications protect, it don't damage the kidneys. It's hypertension itself that can damage the kidneys. Some men say, when they take BP medications, or men say they become impotent. That's why I say you must consult your physician. You must consult your physicians. It's very important. Some say it affects their sexual dysfunction. Your physician will direct you. If you go to the roadside patent medicine store to take medications, they will give you all sorts, and you come down with issues. But if you see your physician, like I said, every patient is tailored to specific BP medication. So people say when they take herbal remedies, natural treatment, when they watch bitter leaf, hibiscus, tea, garlic, it reduces their blood pressure. In as much as those, they are not essentially proven though. Yes, there's be room that they reduce blood pressure. However, you must not stop your medications. It's only your doctor that can tell you on how to go about your medications. When you're taking those herbal remedies and all that, they are like like lifestyle modifications. They are like lifestyle modifications, but you must continue with your medications, please. Don't stop your medications. And please. People say I only take my medications when my BP is very high. No, take your medication every day. The economic situation of this country is even terrible. You can be coming out from your house now. You can be driving out and one of these tricycles just hits your car. Take your medications every day. And take it in the morning. Don't say, I want to wait to get must prevent. You must prevent. So this is the core of the message when it comes to hypertension being a silent killer and prevention of these conditions. It seems you loved that earlier. But what I was saying is that summarily, we must check our blood pressure regularly. Check regularly, please. Check and know your numbers. Know your numbers. Check. We say previously we say when you're above 40, no, just check regularly. Especially when you have a risk factor. You have a family history. The father, the mother, the auntie, I want to uncle in the village. Check your blood pressure regularly. Once, twice a week. Know your numbers. Then when it's elevated, see your doctor, please. Consult with your doctor. Don't just go and take different medications and all that. Never stop your medication abruptly. Be consistent on your medication. And look out for symptoms, please. Go for checkups regularly, please. Then prevention. Prevention, lifestyle modification is the key. So summarily, these are all the things that we could do to help to prevent hypertension, prevent sudden. Hypertension is a killer. It's a killer. I worked in the emergency center for some years. And when I'm on calls on Sundays, I usually see 2 to 3 patients being rushed in. Already have hemorrhagic stroke. So you want to have maybe that sympathetic drive, that anxiety in church while shouting, and they are not even taking BP drugs, and they don't even know, just collapse. You see somebody just say, it collapsed, so they run to the hospital. The doctor didn't even check him, they say he's dead. Those are the things. Those are silent killers. Hypertension does not have symptoms. It comes with other symptoms too, but there are times you might not be symptomatic. Blood pressure will be hitting the roof. So please, don't follow all this. I think we will be free. We will prevent this sudden death killer. And we'll live heavily. Thank you.
Wow. Thank you so much. I mean, I was texting them. I said you've touched on everything that we have in our notes, to be honest, because you've gone even over and beyond. Because, like you rightly said, one of the things that we don't do well in Nigeria is checkups or paying attention to our health. And many times we hear, like I said at the beginning, oh, he just dropped dead. Oh, suddenly, it happened suddenly. But even though, from what I'm hearing you say, even though hypertension is a silent killer, there are still ways that you can still monitor it because it doesn't come with symptoms, which is checking your blood pressure regularly, right? Which is making sure you're eating right. There are lifestyle changes that we should inculcate from the beginning. We don't have a walking culture in Nigeria or in Lagos for that matter, everywhere. So I typically take walks in the evenings. I haven't done it in a while, to be honest, because when I want to do it in the evening, I live in an estate, but my estate is not big enough for me to walk around. And how I prefer to walk long distances than to just be walking the same, it's like a U thing up and down. I'll get bored. So, or in my compound, I will get bored. So I prefer to just take a really, really long walk. But by the time I come out of my estate, I'm coming into town and there's just people everywhere and vehicles everywhere and places that are supposed to be like the pedestrian path. You cannot pass the place because you are dragging the tiny path you're supposed to walk on with an Okada rider, a fellow leg walker, keke, and motor vehicle. So for me, it's when I think, oh, let me go for a walk, and I'm thinking, oh, more the cars I'm going to see on the road. I don't think I have this power, but I'm taking that to say I should find a way around it because we don't have a walking culture. If you want to go from here,
that's why you should harness your environment. I clamor for that. Harness your environment. Even security issues these days, you don't want to go out very early in the mornings, but your immediate environment, harness it. You can plug your earphones and be moving around. Just move around. You mustn't move too fast. As you are moving, move your hands, move your legs. Just sweat a bit. Just small, 15 minutes. That's okay. That's okay for you.
So you can just do like indoor cardio and things like that is what you're saying.
Yeah, certainly. Harness your environment. You won't be staying in a very big estate. No. Harness your environment. There's a bit of space in your environment. No matter how small the place is. Harness it, please.
Okay, for the food, you also mentioned the food. So, um, should we? You mentioned salt. You mentioned, I think it was salt that was a major one. What about fatty foods and things like that? Are those foods? Is that
Yes,
something that we should pay attention
in terms
to?
of prevention, we said, in terms of prevention, yes, fatty foods are things you need to avoid or totally reduce. Why is that they cause a lot of problems on our vessels, on the vessels, and by so doing, the hypertension goes with the vessels. If you are taking too much fatty food, have you seen a water pipe before? A
Mm-hmm.
old water pipe. When you break that pipe, you see some white crust on the pipe. Same also when you take excess fatty food, those plaques are deposited on the blood vessels.
Hmm.
If those plaques break up, if they break, no blood is flowing through your blood vessels. If those plaques break up and they move straight, they can cause sudden heart attack. They can even go block the blood vessel supply in your brain. The thing comes down with stroke.
Hmm.
It can cause a lot of problems. So that's how we say, please, in terms of your meal, reduce your intake, or even stop intake of your fatty foods as
Hmm.
much as possible. Stop, please, as much as possible, as
Okay.
much as possible.
You talked about myths earlier on, but I'm not sure that you mentioned. I don't know if I heard you mention the myth that blood pressure only affects older people. Because a lot of
Yeah,
we're seeing
I did
now that you did,
yes, I
Abby.
did,
I'm not sure I caught them.
yeah, I did mention that I've seen 20s, patients in their 30s and 30s coming down with not just high blood pressure, with end organ damage,
Wow.
chronic kidney diseases. They are dialyzing. They are going to dialysis regularly.
Hmm.
20s and 30s. So it's not disease of old people. Don't just think it's no, not for old people. That no, it's now in all ages. So checking is the key.
All right. Thank you so much, Demi.
Thank you so much, Dr. Akaniga Bernard, for today's discussion on hypertension and sudden death prevention. If you would like to speak to the doctor privately, you can download the TeleDoc app today. You can book a full 30-minute session with the doctor, choose your preferred time, upload your medical records, and speak securely through video consultation. At the end of that, you will receive your prescription digitally.
Thank you so much again, Dr. Akaniga, for coming on the show. I'm sure that at least I learned so much on this program today, taking care of my health, taking advantage of the areas in my environment to walk in. To at least you said I must just sweat, even if it's for 15 minutes. Sweat and then to pay attention to what I'm putting in my body. I don't drink, I don't smoke, so that one didn't apply to me. But if you smoke or drink, Dr. Kaniga has said that no, like those things are harmful to your health. This is not about doing guide. There's no guide there. It's harmful to your health. And yeah, prevention is better than cure. Again, thank you so much, Dr. Akaniga, for coming on today's edition of Radio Doctor. Do enjoy the rest of your day.
Thank you. Thank you.
All right. Radio Doctor on Women Radio WFM 91.7 is Nigeria's first specialized radio health program, broadcast Mondays through Fridays at 10 a.m. Join us tomorrow for another edition at 10 a.m. for the last edition for this week on Friday. Many thanks to Aisha Sani and the executive producer, Tomoki Wale Shonaya. My name is Fumi.
My name is Demi.
Have a great day. Have a healthy day.
Do have